Welcome to the deep dive. We take a stack of information, pull out the key insights, and get you up to speed fast. Today we're digging into something that might seem straightforward, a wound on a cow, but it actually opens up a whole world of issues. We're talking animal welfare, yeah, but also global food systems, even the economy. We've got a great stack of sources today covering everything from, simple scrapes right through to some pretty serious systemic diseases. Our mission: to really unpack bovine health, look at how common injuries and maybe less obvious conditions affect cattle, and explore the surprisingly sophisticated ways they're managed and prevented.
Exactly. And I think what's really fascinating here is that wounds aren't just, cuts and scrapes you can see easily. It's a really diverse range of conditions. Physical trauma, yes, but also complex infections, even systemic diseases that show up with wound-like effects. And if you connect that to the bigger picture, well, the challenges these pose for livestock health are just pervasive. They hit animal welfare, productivity, economic viability. It's a global thing.
Okay, let's unpack that. When we think wound, we usually picture something physical, right? A cut, a scrape. And our sources definitely highlight several types of those traumatic wounds. Maybe let's start there. What are the common ones?
Sure. So on the physical side, you've got abrasions. These are just superficial skin damage, like scrapes. Usually heal okay on their own. Then lacerations. These are tears or cuts, often from things like barbed wire fences or maybe farm machinery. And the key thing here, if you see lameness along with a laceration, that's a bad sign. It often points to severe underlying damage, maybe tendons or joints. Prognosis isn't great then.
Okay, so deeper damage is a real concern with lacerations.
Definitely. Then you have puncture wounds, thick nails, sharp sticks, that sort of thing, deep marrow wounds. These are particularly risky because they create an environment without oxygen deep inside, an anaerobic environment.
Right, perfect for nasty bacteria.
It's exactly. High risk for these infections, and especially tetanus. That's a big worry with punctures. We also see contusions, which are basically bruises from blunt force that cause swelling, pain. And interestingly, these are often linked to less than ideal handling practices or maybe issues with the facilities themselves. A recurring pattern points to management.
So the wounds themselves can be indicators.
Precisely. There are also avulsions, where skin or tissue is actually torn away, usually from pretty violent accidents. And incised wounds, these are clean, straight cuts. Think maybe teat lacerations on dairy cows from wire, or even a milking machine issue. But the main takeaway really is that frequent traumatic wounds usually aren't just bad luck. They're often a signal flare for underlying management problems. Time to check the fences, the handling, the whole setup.
That makes sense. A pattern isn't just coincidence. Okay, so that covers the physical trauma, but you said this gets more complicated. Here's where it gets really interesting, I think. Beyond physical stuff, our sources talk about infectious conditions presenting as wounds or affecting skin health. What are we looking at there?
Right, this is a big category. First up, abscesses. These are basically localized pockets of pus, usually caused by a bacteria getting in through a small wound, maybe even an improper injection site. Common culprits are things like staph, strep, Corynebacterium. If they're not treated, that infection can spread systemically, which is obviously much more serious.
Okay, so abscesses need prompt attention. What else?
Then there's foot rot. Its proper name is interdigital phlegmon. It starts with some kind of trauma to the skin between the cow's toes. That lets bacteria, especially one called Fusobacterium necrophorum, invade. The result: acute lameness, lots of swelling, pain. It's really common in wet, muddy conditions.
Sounds painful. And digital dermatitis, that one seems to come up a lot, especially in dairy. Sounds tricky.
Oh, it definitely is. Digital dermatitis, or DD, is a really painful, highly contagious inflammation, mostly on the hind feet, right near the hoof. It looks different depending on the stage, sometimes like raw, ulcerated patches, other times like these weird, raised, sort of hairy warts. But typically it's painful, it's moist, and it has a pretty characteristic bad odor.
Hairy warts. Okay. And what causes it?
It's primarily caused by various anaerobic spiral-shaped bacteria called Treponema species, but they usually need some pre-existing skin damage to really get a foothold. What's actually quite insightful for vets and farmers is the M-stage classification system. It's widely used. It helps categorize the DD lesions based on how they look and whether they're active, ranging from healthy skin, M0, to the really acute, painful M2 stage, or chronic lesions like M4.1.
So a way to track it.
Exactly.
Yeah.
And because it's often caused by multiple types of bacteria working together, it's polymicrobial. Just targeting one type of bacteria with treatment often isn't enough. Makes it tough to clear completely.
Right. Complex problem. What else falls under infections?
Well, there's fly strike. This happens when fly larvae maggots hatch on the animal's skin. and start feeding on its
Oh,
tissues.
that's grim.
It is. It's more common in young calves, especially in warm, wet weather. And the big danger, apart from the tissue damage itself, is secondary bacterial infections. It can lead to septicemia or toxemia. Plus, some flies, like horn flies, can actually transmit bacteria like Staphylococcus aureus to udders, which increases the risk of mastitis in dairy cows.
Wow, so flies are more than just a nuisance.
Absolutely. And finally, let's mention mange. This covers various skin infections caused by mites, tiny little arachnids. Different mites cause different types, like Coreoptes, Sarcoptes, Demodex. The result is hair loss, really intense itching, skin damage, and it significantly degrades the quality of the hide, which means real economic losses for producers.
Okay, so we've got physical trauma, infectious wounds. But then you mentioned something even less obvious, systemic diseases that look like wounds or have wound-like effects. That seems counterintuitive. How does a whole body disease show up like a wound?
Yeah, it's about how the disease impacts the body overall, sometimes leading to skin issues or mimicking severe injury. Take anaplasmosis. This is a tick-borne disease. The culprit is Anaplasma marginale, and it primarily infects and destroys red blood cells. So the main effect is progressive, often severe anemia.
Okay, so weakness, lethargy.
Exactly. High fever, too, like 103 to 107 Fahrenheit. They go off their feed, lose weight fast, and their mucous membranes get pale, sometimes yellowish or jaundiced. A really key diagnostic point, though, is that unlike babesiosis, which we'll get to, you don't see hemoglobin in the blood or urine. So no red water.
Ah, a key differentiator.
Yes, and the severity is very age-dependent. Adult cattle, say over 2 years old, get hit much harder. Mortality can be 30 to 50% if they're not treated. And here's a crucial part. Animals that survive become lifelong carriers. They seem healthy, but they carry the organism and can spread it. Plus, they can relapse if they get stressed. It makes control really complicated.
Lifelong carriers. Wow. Okay, what about the babesiosis you mentioned? Red water.
Right, babesiosis, also known as red water or Texas fever. Another tick-borne disease caused by Babesia species. These are protozoan pterocytes, and they also invade and replicate inside red blood cells, causing hemolysis cell destruction and anemia.
So, similar signs to anaplasmosis.
Some overlap, yes. High fever, pale mucous membranes, often jaundice. But with babesiosis, you do frequently see hemoglobinuria, dark or red urine, hence red water and hemoglobinemia. That's a key difference. And with one type, B. bovis, you can even get severe neurological signs, things like incoordination, teeth grinding. Interestingly, calves under about 9 months usually get infected without showing signs. They develop immunity. Oh, and Babesia divergens can actually infect humans, so there's a zoonotic potential there too. Historically, the U.S. eradicated Texas fever, which was a huge effort.
Okay, another serious one. What else fits this systemic category?
Let's talk trypanosomiasis. This is a group of parasitic diseases caused by Trypanosoma species. You might know names like Nagana in Africa, transmitted by tsetse flies, or Sura, which is spread mechanically worldwide.
Nagana, right? I've heard of that. Affects livestock significantly in Africa.
Hugely. Clinical signs include intermittent fever, anemia again, swollen lymph nodes all over, and progressive weight loss. They basically waste away. Milk yield drops, immune system gets suppressed. The economic impact is just massive. We're talking billions of dollars annually. And it's not just the cost of sick animals or treatment. A really critical, maybe underappreciated impact is impaired animal traction.
Meaning they can't work.
Exactly. Sick oxen can't plow fields. This leads directly to lower crop yields. It's a major, major barrier to agricultural development in affected regions.
Wow, that's a connection you might not immediately make. The ripple effects are huge.
They really are.
Yeah.
And one more to cover here. Bovine leukosis lymphoma, or BLVEBL, this is caused by the bovine leukemia virus. It sets up a lifelong infection. But here's the thing. The vast majority, like up to 95% of infected cattle, remain completely asymptomatic carriers. They look fine.
So it's mostly hidden.
Mostly hidden, yes. A small percentage, maybe 0.1% to 10%, will eventually develop malignant B-cell lymphoma, usually when they're older, maybe 4 to 8 years old. We should quickly note there are also 3 sporadic forms of bovine leukosis: juvenile, thymic, cutaneous, but these affect younger animals and aren't caused by BLV.
Okay, got it. So for the BLV-caused lymphoma, what are the signs?
Highly variable. It completely depends on which organs get tumors. Could be large lymph nodes, problems with the stomach, the obomasum, spinal cord issues causing paralysis, heart problems. It really depends. The truly insidious thing about BLV is this huge pool of asymptomatic carriers. That imposes a massive economic burden, especially on the dairy industry. Estimates for the U.S. alone are over $500 million a year, mainly from reduced milk production. Plus, you have issues with carcass condemnation at slaughter and trade restrictions.
$500 million just from reduced milk and related issues. That's staggering.
It is. And there's also ongoing research, though it needs more confirmation, exploring a potential link between BLV infection in cattle and human breast cancer. Still very much in the research phase, though.
Okay, that's a sobering thought. Right, so we've covered this incredibly broad spectrum: physical wounds, infections, systemic diseases acting like wounds. With such a huge range, how on earth do you manage them? Let's talk treatment. Our sources outline some clear principles, starting with assessment. How does that work?
Yeah, managing these requires a systematic approach. It always starts with initial assessment and classification. You need a really thorough exam. What type of wound is it? How deep? How big? Where is it? How old is it? Critically, how contaminated is it? Based on that, you classify the wound maybe clean, contaminated, or dirty. That classification is key because it dictates the next steps. For instance, only clean or maybe clean contaminated wounds are suitable for immediate primary closure, sewing them up right away.
Okay, so assessment guides the strategy. Then what?
Cleaning. Absolutely. Cleaning and debridement are fundamental. The goals are pretty simple. Reduce the bacterial load, get rid of any foreign material, and cut away any dead or necrotic tissue. Cleaning often involves lavage, basically flushing the wound. You use lots of warm, balanced electrolyte solution or sterile saline. Importantly, you want to avoid high-pressure flushing, say over 13 psi, because that can actually drive contaminants deeper into the tissue. Gentle, copious flushing is key.
Not blasting it clean, then.
No, definitely not. You can use diluted antiseptics like chlorhexidine or povidone iodine, but, and this is important, you avoid hydrogen peroxide. It's actually toxic to the healthy cells you need for healing.
Good to know. And debridement, that's removing the bad tissue.
Exactly. Debridement is removing non-viable tissue. The main way is surgical sharp debridement using a scalpel to cut back to healthy tissue that bleeds. But there are other methods too, like autolytic, using the body's own enzymes, mechanical, like wet to dry bandages, though less common now, enzymatic, using ointments, or even biological debridement.
Like maggot therapy.
Like maggot therapy, yes. It's still used and can be very effective for certain wounds. What's fascinating and requires real skill during debridement is the balance. You have to be aggressive enough to remove all the dead stuff and contamination, but gentle enough to preserve as much healthy tissue as possible. It takes meticulous judgment.
A delicate balance, indeed. Okay, wound assessed, cleaned, debrided. Now what? Closing it up, preventing infection. That seems like the next critical phase.
Precisely. Now you decide on wound closure techniques and simultaneously manage infection control. For closure, you have options. Primary closure is stitching or stapling the edges together immediately. Best for clean, fresh wounds with minimal tissue loss.
The ideal scenario, maybe?
Often, yes, but not always possible or wise. Then there's delayed primary closure. Here, you manage the wound open for a few days, maybe 2 to 5, let it clean up a bit, then close it before granulation tissue forms. Honestly, this is less commonly successful in large animals like cattle because their wounds tend to retract quite a bit, making closure difficult later.
Right. So what's the alternative if you can't close it?
That's secondary intention healing. You basically leave the wound open and let the body heal it from the inside out. It heals through granulation tissue, filling the gap, wound contraction, pulling the edges inward, and finally epithelialization, which is new skin growing over the surface. This is the go-to for heavily contaminated or already infected wounds.
So you have to constantly reevaluate which approach is best.
Exactly. Wound management is dynamic. You might start planning for one type of closure, but if the wound isn't progressing well or shows signs of infection, you adapt. Constant monitoring and reassessment are absolutely key.
Makes sense. And infection control alongside this. Antibiotics.
Yes, infection control is paramount. Antibiotic use is often necessary. We use systemic antibiotics given by injection, usually like penicillin, oxytetracycline, ceftiofur for deep wounds, or those with significant contamination or established infection. For more superficial wounds or specific things like digital dermatitis foot baths, topical antibiotics or antiseptics might be used like silver sulfadiazine cream or terramycin spray.
But we hear so much about antibiotic resistance.
A critical point. We absolutely emphasize judicious use. That means using the right antibiotic at the right dose for the right duration and only when truly necessary. Ideally, you'd perform a bacterial culture and sensitivity test from the wound that tells you exactly which bacteria are present and which antibiotics will actually work against them. It's a cornerstone of good antimicrobial stewardship.
Targeted treatment, not just broad-spectrum guessing.
Precisely. Another key part of infection control is drainage. If you have a deep wound or dead space where fluid can collect, That fluid is a perfect medium for bacteria to grow. So placing drains, either passive ones that let fluid seep out, or active suction drains can be crucial to remove that fluid and allow healing.
Right. Prevent fluid buildup. And tetanus, you mentioned that earlier.
Always a concern, especially with punctures or dirty wounds.
Right.
Tetanus prophylaxis is vital. We have two main tools. Tetanus toxoid is the vaccine. It stimulates the animal's own immune system to produce long-lasting protection, active immunity. Then there's tetanus antitoxin, sometimes called TIG. This provides immediate but temporary protection by giving the animal preformed antibodies, passive immunity. For an unvaccinated calf undergoing a risky procedure, like castration with bands, you might give both the antitoxin for immediate cover and the toxoid to start building long-term immunity.
Okay, that covers the technical side well. But what about the animal's experience? Pain management seems crucial, not just ethically, but for recovery too.
Absolutely essential. And you're right, it's not just ethics. Good pain management demonstrably improve outcomes. We use several approaches. Local anesthetics like lidocaine are great for numbing a specific area for procedures like dehorning, castration, or stitching up a wound. Blocks the pain signals right there. For more extensive or painful procedures, general anesthetics might be necessary. And then for managing pain after the procedure or injury, analgesics are key. NSAIDs, non-steroidal anti-inflammatory drugs like flunixin, miglumin, or meloxicam are very commonly used. They reduce both pain and inflammation.
So numbing during, pain relief after?
Exactly. But it's not just drugs. Non-pharmacological support is just as important. Providing a calm, low-stress environment makes a huge difference. Ensuring they have easy access to food and water, providing clean, dry, deep bedding for comfort. These things matter. What's fascinating and a key insight for producers is that comprehensive pain control isn't just nice to have, it's a practical strategy. It improves welfare, speeds up healing, reduces stress, and can actually minimize those long-term production losses we talked about.
Better welfare equals better productivity, in a way.
In many ways, yes. And that ties into overall supportive care. Wound healing isn't just about the wound itself. Several factors are crucial. Maintaining a moist wound environment, not wet, but moist, actually helps cells migrate and speeds healing. Counterintuitive to the old let it air dry idea.
Interesting. Moist is better.
For most wounds, yes. Providing balanced nutrition is also critical. If an animal is deficient in protein or certain vitamins and minerals, wound healing will be significantly delayed. Clean and dry environmental control is obviously important to prevent further contamination. You need good blood supply and oxygenation to the wound. Poor circulation hinders healing, and restricting motion of the injured part is often necessary, especially for wounds over joints or on limbs. Sometimes that means bandages, splints, or even a fiberglass cast for high-motion areas.
So it's really a whole animal approach.
Absolutely. If you connect this to the bigger picture, optimal wound healing depends heavily on the animal's overall physiological state. Its nutrition, its immune function, its stress levels, they all play a huge role. It really underscores the need for holistic herd health management.
Okay, that makes perfect sense. Now, you've laid out all this careful management, but what happens if things go wrong? If wounds aren't treated properly or complications arise, what are the risks then?
Well, the consequences of neglect or improper management can be severe. We see a range of complications. We already mentioned abscesses, those localized pockets of infection. If not drained, they can persist, enlarge, or even spread infection through the bloodstream. Cellulitis is another risk that's a rapidly spreading inflammation of the subcutaneous tissue, the layer just under the skin. Makes the area hot, swollen, painful.
That sounds like it could spread quickly.
It can. Then there's something called proud flesh, or exuberant granulation tissue. This happens when the granulation tissue, that pinkish tissue that fills in a healing wound, grows excessively. It actually grows up above the skin level and prevents the skin edges from closing over it. Leads to chronic, non-healing wounds that are difficult to manage.
So, too much of a good thing in that case.
Exactly. A much more serious risk is sepsis. This is a life-threatening, whole-body inflammatory response triggered by an infection getting into the bloodstream. Organ failure can follow. Very dangerous. If a wound is deep, especially near bone, or if a puncture introduces bacteria deep inside, you can get osteomyelitis. That's infection of the bone itself. Very difficult and costly to treat.
Bone infection sounds nasty.
It is. And, of course, a very common and direct consequence, especially with foot or leg wounds, is lameness. Lameness is hugely significant. It causes pain, reduces mobility so they can't get to food and water easily, impacts fertility, lowers milk production or weight gain. It's a major welfare and economic issue.
And all these complications ultimately lead to
Ultimately, they often lead to significant weight loss, reduced productivity, increased treatment costs, premature culling, and in severe cases, mortality. This really raises an important question, or maybe reinforces a point. Why does the cost of a wound seem to spiral? It's because failing to treat it promptly and correctly allows for this compounding effect. A seemingly minor injury escalates into a complex, chronic mess, requiring extensive, expensive, and often less successful treatment later on. It hammers home why immediate effective wound care is just fundamental to sustainable livestock production.
That domino effect you mentioned earlier, prevention and early intervention are clearly key. So given all these complexities, the potential complications, the costs, prevention has to be the name of the game. And our sources point to a really comprehensive, multi-pronged approach going way beyond just treating sick animals. What does effective prevention look like?
Prevention is absolutely central. And you're right, it's multifaceted. It really starts with strong biosecurity and herd management practices. Probably the single most effective strategy, especially for diseases like digital dermatitis or BLV, is maintaining a closed herd policy. Don't bring in new animals if you can avoid it.
But farms often need to bring in new stock, right?
They do. So if you must bring animals in, strict quarantine protocols are non-negotiable, minimum 1-month isolation. During that time, health inspections, diagnostic tests for diseases prevalent in your area, or the source herd like anaplasmosis or BLV testing.
Quarantine and test. Makes sense.
Then, rigorous equipment hygiene. This is critical but sometimes overlooked. Using sterile, disposable needles, 1 per animal for injections. That's basic but vital. Meticulously cleaning and disinfecting all surgical and handling tools between each animal. Think dehorners, hoof knives, ear taggers, anything that can transfer blood or tissue. Electric dehorners, by the way, are generally preferred over scoops because they cauterize and minimize blood transfer.
Little details matter.
Hugely. Proper manure management is also key. Things like slatted floors, regular scraping of walkways. This helps control infectious foot diseases like foot rot and DD, and also reduces breeding sites for flies. And segregation of animals. Keep sick animals isolated, obviously, but maybe also manage groups based on age or disease status if applicable. What's fascinating here from a practical standpoint is that implementing biosecurity often involves this constant balancing act, weighing the cost and effort against the potential disease risk. It's not just a checklist. It's a dynamic, risk-based strategy.
A constant calculation. Okay, what about the environment itself?
Environmental modifications are huge. Maintaining clean and dry environments is probably the most important thing for preventing infectious foot conditions. Slurry, constant wetness, it damages skin integrity, making hooves vulnerable. So that means things like providing ample dry bedding, ensuring good ventilation in barns, regular scraping of alleys.
Their feet dry. Essentially, yes. Also, ensuring proper stocking density. Overcrowding leads to damper conditions, more stress, more competition. Eliminating hazards is basic but crucial. Regularly walk pastures and pens, remove sharp objects, fix broken fences that could cause lacerations, and provide adequate shelter from extreme weather, both heat and cold, to reduce stress. If you zoom out, proactive environmental control is really a primary defense. It's often more sustainable and less reliant on chemicals than just reacting to outbreaks. Good for welfare, good for the bottom line.
Right, creating a healthier space overall. Now, what about those vectors? Flies, ticks, mites. They're not just annoying, they cause damage and spread disease. How do you control them? Vector control. A massive challenge. External parasites are a huge drain irritation, blood loss, reduced weight gain, disease transmission like anaplasmosis, babesiosis, pink eye. We do have chemical control options. There are various classes of chemicals, organophosphates, pyrethrins, pyrethroids, macrocyclic lactones like ivermectin, formamidines, insect growth regulators. They're applied in different ways. Dips, sprays, pour-ons, insecticide ear tags, injections, even feed-through products.
Sounds like a lot of chemical tools.
There are. But here's the massive caveat. Resistance. Acaricide and insecticide resistance is a major and, frankly, growing problem. Parasites evolve mechanisms to survive these chemicals. They might metabolize the drug faster, or the target site in their body might change so the drug doesn't bind properly.
Evolution in action, working against us.
Exactly. And improper use, like underdosing or using the same chemical class over and over, really accelerates the development of resistance. So this raises the question, are we winning this arms race against parasite evolution? The honest answer is no. Relying solely on chemicals just isn't sustainable long-term. We have to be smarter.
Which means rotating chemicals.
Rotating chemical classes is part of it, yes. But it really underscores the need for non-chemical control methods as part of an integrated pest management or IPM approach.
IPM, what does that involve?
It's about combining multiple strategies. Biological control, like releasing tiny parasitoid wasps that attack fly pupa, or encouraging dung beetle populations which break down manure and disrupt fly breeding. Cultural practices, things like good sanitation, removing manure frequently. Pasture management, like keeping grass shorter in tick-prone areas, can help. And physical removal or traps, various types of fly traps, or even just physically removing ticks when feasible.
A more holistic approach to pest control.
Exactly. And we also have to consider the climate change impact. Rising temperatures are allowing vectors like ticks to expand their ranges northward, and warmer conditions can speed up parasite life cycles. This means we need better surveillance and more adaptive management strategies going forward.
Climate change affecting even parasite distribution.
Wow.
Okay, what about vaccines? Are they a major tool in prevention?
Vaccination programs are definitely a critical tool, but availability and effectiveness vary widely depending on the disease. For anaplasmosis, there's a kill vaccine available in the U.S. It helps reduce the severity of disease and death loss, but, and this is key, it does not prevent infection or stop animals from becoming carriers. Live vaccines exist elsewhere, but aren't licensed here due to safety concerns.
So helpful, but not a complete solution for anaplasmosis.
Correct. For babesiosis, live attenuated vaccines are used effectively in endemic areas and provide pretty solid protection. But then you get to bovine leukosis virus, BLV. Despite decades of research looking at all sorts of vaccine technologies, there are currently no safe and effective commercial vaccines available to control BLV infection. None.
Really? For such an economically significant disease?
It's a major gap.
Yeah.
And this disparity is fascinating, right? For widespread, costly diseases like BLV, where we lack a vaccine, the pressure falls entirely back onto those stringent biosecurity and management practices we discussed. Thankfully, for tetanus, we do have a very effective and recommended vaccine, the tetanus toxoid, for providing active immunity.
So vaccines are part of the toolkit, but definitely not a silver bullet for everything.
Not at all.
Oh.
Which leads to another important long-term strategy, genetic resistance. Breeding animals that are naturally more resistant to certain diseases offers a really sustainable approach.
Selecting for toughness.
In a way, yes. We know certain cattle breeds have innate resistance. For example, Bort's indicus breeds, think Brahman cattle, generally show much greater natural resistance to ticks and tick-borne diseases like anaplasmosis, and also to trypanosomiasis compared to Bort's Taurus breeds like Angus or Holstein. There's also evidence for a genetic component influencing susceptibility to digital dermatitis. So producers can potentially use genetic selection over time to breed cows that are less likely to develop DD.
So using genetics as a defense.
Exactly. And if you think about the big picture, genetic resistance is this powerful, built-in, heritable defense. It doesn't drive resistance evolution like chemicals do. It enhances the herd's overall resilience and reduces the need for constant external interventions like drugs or pesticides. It's a very promising long-term strategy.
Okay, a truly multi-pronged approach then. Biosecurity, environment, vector control, vaccines where possible, and genetics. Now, we've touched on costs throughout this, but let's circle back and really focus on the economic reality. You mentioned staggering figures earlier. Our sources detail both the obvious and the hidden costs. Can you break down what these wounds and diseases really cost producers and the industry?
Absolutely. The economic fallout is immense, and it's crucial to understand both types of costs. First, you have the direct costs. These are the immediate out-of-pocket expenses you can easily point to. Things like the vet's bill for consultation and treatment, the cost of medications, antibiotics, pain relief, parasiticides, the extra labor needed to handle and treat sick animals, maybe costs for specific supplies like bandages, and importantly, lost revenue from things like discarded milk during drug withdrawal periods. If a dairy cow is treated with certain antibiotics, her milk can't go in the tank for several days. That's a direct hit.
Okay, the obvious bills. But you mentioned hidden costs.
Right, the indirect costs. These are often harder to quantify precisely, but they represent a massive ongoing drain on profitability, often much larger than the direct costs. Think about reduced milk yield. We mentioned digital dermatitis studies show it can easily knock off a pound, maybe a pound and a half of milk per cow per day. That adds up incredibly fast across a herd. Reduce weight gain or production performance in beef cattle, those horn flies we talked about, Estimates suggest they can reduce daily weight gain by up to half a pound per animal. That's huge for feedlot efficiency.
Half a pound a day just from flies.
Wow. It's significant.
Hmm.
Then, impaired fertility and reproductive issues. Diseases like DAD can increase the time it takes for a cow to get pregnant again after calving, maybe by 25 days, and decrease the conception rate significantly, perhaps by over 13%. Fewer calves, less milk in the long run, increased culling and mortality. Animals that get too sick or become chronically lame or fail to rebreed often have to be culled prematurely. And diseases like anaplasmosis have high mortality rates in adults, as we discussed, maybe 30% needing to be culled, another 30% dying. It's a huge loss of investment.
Losing productive animals early.
Exactly. Reduced carcass value or condemnations at slaughter. Bruises from poor handling mean that part of the carcass has to be trimmed and discarded. Mange ruins hide value. Certain diseases or abscesses can lead to partial or even whole carcass condemnation. And finally, trade restrictions. If a region or country has certain diseases, it can face restrictions on exporting live animals or animal products. That impacts the entire market.
The ripple effects just keep expanding. Can you put some overall numbers on specific diseases just to illustrate the scale?
Yeah, the total figures are pretty staggering. Let's take anaplasmosis. Estimated cost to the U.S. beef industry is over $300 million annually. A single clinical case is estimated to cost a producer around $660 per animal. Globally, it's maybe $1 billion a year. Digital dermatitis. Huge impact in dairy. Estimated at $1.4 billion annually in the U.S., assuming about 25% herd prevalence. A single case costs somewhere between $76 and $533, averaging around $337. It's the single biggest driver of lameness costs on dairy farms.
1.4 billion for DD.
Yeah. Trypanosomiasis in Africa. Overall economic impact on agriculture in tsetse-infested areas is estimated at US $4.5 billion annually, largely due to that lost animal traction affecting crop production. Bovine leukosis. BLV. We mentioned the U.S. dairy impact over $500 million annually just from reduced milk production. That contributes to an estimated $2.7 billion national deficit related to BLV. Flies, just flies in general. Total annual loss to U.S. cattle production is estimated at $6 billion. $6 billion. For $6 billion. Includes weight loss, treatment costs, disease transmission, and lice. Over $125 million lost annually in the U.S. Lameness in general, remember, costs $76 to $533 per case. So again, it comes back to that compounding effect. Failure to prevent or quickly treat escalates costs dramatically. Effective health management isn't an expense, it's investment crucial for sustainable production.
What a journey through bovine health this has been. From a simple cut to global economics, it's really clear that what looks like one small problem is actually woven into this huge, intricate system. Animal well-being, farm viability, even our food supply.
Yeah.
I mean, the big takeaway for me is just the absolute necessity of that multifaceted, integrated approach you've described. Prevention, early detection, smart treatment. So, thinking about all these layers, the complexity from, tiny mites and bacteria right up to global climate patterns influencing disease.
It really does make you think, doesn't it?
Yeah.
And perhaps this is the final question for us and for you listening. As our understanding keeps getting deeper, we're learning more about microbial resistance, about climate change impacts on where parasites live. How do our strategies need to evolve? How do we move beyond just reacting to problems and truly embrace a proactive, maybe even an ecosystem-wide approach, not just to livestock health, but ultimately to our global food security?
That's a powerful thought to end on, an ecosystem approach. Thank you for joining us on this deep dive. We hope you're leaving feeling a bit more informed, maybe a little surprised by the connections, and definitely more curious about the hidden complexities shaping our world. Keep learning, keep questioning, and we'll see you on the next deep dive.